Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Severity of hemoptysis. So, in the severity of hemoptysis can be divided into four types actually. One, mild hemoptysis. In mild hemoptysis, if the blood loss is less than 100 ml per day, then we call it as mild hemoptysis. Second, moderate hemoptysis. If the blood loss is between 100 to 150 ml of blood is lost per day, then it is moderate hemoptysis. Third, severe hemoptysis. In severe hemoptysis, if there is up to 200 ml of blood is lost per day, then it is severe hemoptysis. So first we have mild hemoptysis with 100 ml blood loss per day, moderate hemoptysis with 100 to 150 ml of blood loss per day. Then there is severe hemoptysis with over 200 ml of blood loss per day. Then we have massive hemoptysis. In massive hemoptysis, there is more than 500 ml of blood is lost per day, or the rate of blood loss is almost more than 150 ml per hour, or if there is 100 ml of blood loss is present per day for more than 3 days, then we call it as massive hemoptysis. For massive hemoptysis, we have three criteria. One, if there is more than 500 ml of blood loss per day, or if the rate of blood loss is more than 150 ml per hour, or if there is 100 ml of blood is lost per day for more than 3 days, then we call it as massive hemoptysis. If there is more than 500 ml of blood loss per day, then always we should do an intervention should be done. That is, we should do either a rigid bronchoscopy or surgery can be done. We should do some intervention if there is massive blood loss, that is more than 500 ml of blood loss is there. If the blood loss is submassive, then fiber optic bronchoscopy is indicated.
thank you and thank you for watching.